Okay, if you're having problems with your sinuses, and so many people are, there's a new procedure that's helping a lot of people, and it's less involved than your traditional sinus surgery. So we've got Dr. Michael Armstrong with the Richmond Ear, Nose, and Throat that's here to tell us all about what's called balloon sinus dilation. So thanks so much for being with us.
Thank you.
Let's talk first about the problems that this addresses and what it's all about.
Well, patients with sinusitis will frequently have pain and pressure in their face. They may have nasal congestion. They may have drainage and loss of smell. And typically, the patient who needs help with balloon dilation or sinus surgery is having 3 or 4 infections every year or has not had relief in more than 3 months.
So let's talk about the balloon procedure and how is it different from surgery?
Well, with surgery, what we would do is take out the sinuses. We would cut away tissue, and we still do that for appropriate patients. But with balloon dilation, we're putting a soft catheter into the sinus, stretching it, much like an angioplasty, without cutting any tissue away. It enlarges the opening, allows the fluid to drain out, and equalizes the pressure.
And it's a lot less invasive than going through a surgical process, and I understand the recovery is quicker too.
Oh, absolutely. Typically it's done in the office under local anesthesia. I just saw a patient half an hour ago who was for surgery a week ago, and he went straight back to the office and continued work the same day. So compared to going to surgery, going to sleep, not eating breakfast, getting a bill from the hospital and the anesthesiologist, this is a much easier procedure.
And you've been participating in a clinical trial of this. What kind of results are you guys seeing?
Well, we just finished a comparison trial where half the patients had balloon dilation and half the patients had sinus surgery. The patients who had balloon dilation took pain medicine for less than a day compared to about 3 days for the surgical patients. They returned to work generally within a day to a day and a half compared to 4.5 days, and they were well within the first week.
Does it last as long?
Absolutely. We've published results showing that it lasts at least equally for a year. We've got further results in other studies showing 2 years and longer results.
Wow. Okay, Dr. Armstrong, thanks so much. Here's the information if you want to get more information or get in touch with Dr. Armstrong. Again, he's at richmondent.com, and it's balloon sinus dilation. Thanks so much for being with us. I hope it helps a lot of people.
Thank you.
You bet. And we'll be back in just a moment.